The Cumberland County Department of Public Health offers a free diabetes self-management education program to help diabetic patients take control of their health. The program is funded by a grant from the Kate B. Reynolds Foundation. Program coordinator Sandra Shipley describes how patients living with diabetes can manage their condition and how this program is here to educate and assist them.
The Diabetes Self-Management Education Program is a program actually under the American Diabetes Association, and it is to teach diabetics how to better self-manage their disease through taking their medicines the correct way, eating right, and exercising. In Cumberland County, 1 in 3 people have a diagnosis of diabetes. Because of the complications diabetes can cause, diabetes is a chronic illness. It's characterized by high blood sugars, and our diet, lack of exercise, with all the modern technology, it's really important that we do the things to keep us healthy. There's a saying that says we are what we eat. A lot of it's what we put in our mouth. And so we're seeing a lot of people who aren't eating at home, they're eating out, fast food and different things like that. So we're just overeating. And so we need to get back to eating the right way, getting the proper amount of exercise. And it's just important to managing the diabetes, along with checking your blood sugar, along with doing the things that are important to stay healthy. Taking your medications as prescribed by your doctor. A lot of times we'll get prescribed medications and we have side effects, and instead of calling the doctor, we'll wait till we go back in 3 months and see what's going on. So we're trying to educate people about diabetes just because it is so prevalent in Cumberland County. The Diabetes Self-Management Education Program is a provider-referred program, which means that the person has to go to their doctor and get a referral to be referred to our program. The referral forms are on the Cumberland County website. If you call us, we can fax a referral to your doctor. So we do that, we get the referral in, and then the receptionist places a phone call to set up an appointment. And you have an hour-long initial assessment with a nurse. We assess your learning needs, get a lot of information from you, and then we set you up for diabetes classes. We have 8 hours of class time. We cover the etiology of diabetes. We talk about the diet, how to eat better. We talk about the importance of exercise, the importance of checking your blood sugars, taking your medications. We do this through a PowerPoint, and we also have conversation maps, which brings about conversation. We talk about people's feelings about having diabetes, because a lot of diabetics feel like they're the only ones, and it's very difficult to manage the disease because you do have to change your way of thinking, the foods that you love. You can still eat those, but you have to eat them in the right amounts. And so we talk about this a lot. We talk about label reading, counting carbohydrates and things like this, and how to better have doctor's visits, because when you go into the doctor, they have a limited amount of time to spend with you. So we want people to go in and tell them what their needs are. And like we said, to call if they're having problems, not just wait till the next doctor's appointment, to avoid the complications of diabetes. We also go into the complications of diabetes and what can happen if you have a blood sugar that lasts high blood sugars for a long time. We have people who come in and diabetes runs in their family, for example, and we'll have somebody whose grandmother, they're like, oh, they went on insulin and lost their leg, or they died. And so we try to explain to them that you can manage diabetes without having the complications if you get your blood sugars down and keep them down. And some people come in and they think that they can do things to get rid of diabetes. So we dispel myths that they have. It's very beneficial to be knowledgeable. We found that people just don't know what to eat. You have all these menu options. A lot of people eat out a lot instead of cooking at home. It's always better if you eat at home because you know what you're putting in. When you go out to eat, you don't really know what you're getting or what they put in the foods that you're eating to make it taste better. At home, you always know. So, and the problem is, for example, if you go somewhere to a steakhouse, for example, and they bring out rolls, or a Mexican restaurant and they bring out chips, and you eat those, and then you eat just the meal, they're kind of large, then you've overeating, and really it's probably enough for 2 to 3 meals. And we just, in America, we overeat, and that's why we have the problem with obesity and Even in our children now, we see that. So it's very important to learn what to eat and to eat it in the right amount so that we can figure out how to manage our diabetes when we have it. And you know, we love to help people and just educate people because we found people just don't know what to eat. When people have diabetes and they just ignore it or deny the disease and do whatever they want, the problem is diabetes is a chronic illness, so you don't see the effects of what you're doing until years later. And that's the problem we have with diabetes. You don't see it in the here and now, and a lot of people live in the here and now. So what happens is they're diagnosed at 28, and then by 40 they have diabetic retinopathy, which is numbness and tingling in your feet or burning pain. They will have kidney damage, diabetic retinopathy, which is an eye disease. It affects different people with different ways. And they'll have, when you have the problems with your feet, that's what we're really concerned about, because you can wear, say you don't wear the proper fitting shoes and you get a corn on your toe, that could be a real issue for a diabetic, and it could turn into where they're losing their toe and then a foot and then a leg. So that's very important. All the complications, diabetics are more likely to have heart attacks and strokes, and have kidney disease and be on dialysis, and this is what we're trying to prevent. And this is caused not by so much a diagnosis of diabetes, but not managing your diabetes well, and having high blood pressures for a long time will cause these effects. And we're trying to get people to see that. We've seen that some of our patients who have had strokes and different things, and so we try to get them to be examples to other people so they can say, look, this happened to me, and they can't even twist a lid off of a bottle. They have to have their wife to do it, and that's the one thing that they don't like, is having to depend on somebody else at such a young age, like at 60. For more information about the Diabetes Self-Management Education Program in Cumberland County, you can come to the health department. Our phone number is 433-3615 and 433-3789. If you call those numbers, we can give you more information. That's my number, and Antoinette Nelson is a diabetes educator. You can also call Shannon Oliver at 433-3218. She's the registration person who calls our patients, and get more information.